Hello, everyone. Welcome to episode 48 of the LUMP TCM and Acupuncture series. For our first presentation, let's call on certified acupuncturist, Ma'am Nits Yu of Silang, Cavite. Good afternoon, Ma'am Nits.
Good afternoon, Doc Hector. Good afternoon, everyone. So, dito na tayo, blood deficiency. Okay? So, these are the imbalances of blood deficiency. Blood deficiency may cause Qi deficiency. So, all organs and tissues need blood and nutrition in order to function continuously. Otherwise, they would get exhausted and stop functioning. If heart blood became deficient, the person could have bradycardia, hypersomnia, and problems with concentrating for long. Di makapag-concentrate, okay? If liver blood became deficient, the muscles would tire quickly during activity, madaling mapagod, okay? If spleen blood became deficient, the person would feel weak and hungry, could be weak in the limbs and suffer slow bleeding symptoms. If there is lung blood deficiency, it would cause thin and dry skin that wrinkles and injures easily but does not heal well, okay? And the opening and closing function of the skin would be affected, okay? Kidney blood deficiency would retard the function of menstruation, fertility, sensitivity, and the function of the nervous system. So treatment, use points for blood building. Use move front move and back shoe points for effect of the affected organ, and use tonification of the yang of the coupled organs. Okay? So, blood deficiency can cause dryness. Since blood is a fluid, blood deficiency can cause dryness in the skin, hair, and nails. Parang ako to. This is referred to as blood dryness as opposed to yin deficiency. In this case, dryness cannot be improved by increasing water intake and eating yin type foods. Treatment you have to use blood building points and yin tonification of the related organ. So you have to study, okay? Kung ano-ano yon. Let's go to blood deficiency may cause internal wind to rise. Just as yin deficiency causes yang to rise from time to time, blood deficiency can cause wind to rise from time to time. The symptoms for this rising internal wind would be fibromyalgia, migraine headache, high blood pressure, wandering musculoskeletal pains, or other symptoms of an irritating nature, katulad ng itching sensation, mga makakate. This internal wind rises from liver during liver blood deficiency, but it can attack and manifest in other organs, especially the lungs, which is also blood or yin deficient. Okay? Treatment, use the points for blood building. Use wind elimination points for appropriate area with the correct wind elimination needle technique. So, mayroon pong elimination needle technique. Research po natin. Use liver 2 as wind elimination point and sedate gallbladder 38 to sedate the yang aspect of the liver. Okay? Let's go to blood deficiency may cause coldness. It is clear that if the blood does not reach some place, it will remain cold, malamig. If one is hungry or has had less sleep, konti lang ang tulog, it is normal to feel cold in the body. A good meal or long sleep can make one feel warm again. So, kailangan yon. Blood deficiency coldness usually manifests as a characteristics marbling on the limbs. Okay? This can be observed in patients with chronic tendovaginitis, cellulite, etc. Coldness where there is no blood deficiency shows pale or purplish, usually in blood stagnation coloring. Okay? Treatment, blood building points and many local needles in the affected area. Using of moxa or cupping in the area would also of a great help. Okay po. So that's all, everyone. Thank you for your
Thank you very
attention.
much, Ma'am Nits. Let's now call on Sir Dino Pinheiro of Legazpi, certified associate acupuncturist. to continue his discussion of pulse qualities. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. We continue with pulse qualities, part 3. Okay, sa tension, it's either there is a wiry pulse, soft pulse, and tight pulse. Arterial walls are made of muscles. Therefore, a certain amount of tension is normal and necessary when feeling an artery. This tension is more noticeable in young children, adolescents, and during seasons of spring. This is because both spring and the beginning stages of life are associated with liver, and liver young gives extra tone to the muscles. Next, we have the wiry pulse. This quality shows extreme tension or young excess in the organ. It is like the feeling you get when moving your finger across a guitar string. If such quality is felt over the lung position, it would mean a bronchial spasm, as in the case of allergic asthma. If it is on stomach position, then it may mean a pyloric spasm. As such, a wiry pulse shows us a state of tension in the organ. If the wiry pulse is generalized, it indicates liver yang excess or liver yin deficiency and an internally tense person. A superficial wiry pulse that is generalized may mean climatic factors, a wind pathogenic factor attacking the body externally and still residing in the exterior. Next, we go to the tight pulse. This is similar to a wiry pulse as they are both tense. It is different because a tight pulse has no elasticity. It is muscle that is in constant cramp, but no movement. This is what happens to muscles in cold situations, such as in neck tension that improves in warm weather, or a cold stomach that feels tight and heavy like a stone. A wiry pulse is treated with liver yang sedation or liver yin tonification. A superficial wiry pulse is treated with wind elimination. A tense pulse is treated with heat or moxa as cold problem. Example, yung cramps in cold weather are treated with local hot needle or moxibustion. Next, we go to soft pulse. A soft pulse shows a lack of tension caused by liver yang deficiency and poor muscle tone of an organ. It is often felt in the lower warmer areas. Sometimes one pulse tension position is so soft that it feels like water that was flowing within the confines of the banks of a river has started flowing outside it because the sides were not built high enough. This needs the qi or the functional yang of the organ to be tonified with Bakshu point and Lu connecting point of the yang organ. Thank you for your attention.
Thank you very much, Sir Dino. Let's talk about sweating for our next topic. Sweating is necessary to eliminate the heat by opening the pores and to cool the body surface by using the body heat to dry the sweat. Therefore, it is natural to sweat when feeling hot, but it is not normal or necessary to sweat when one is cold on the coldest areas of the body, or not sweat even when feeling hot. Some people have watery sweat, others have oily sweat, some others have smelly sweat. Ask the patient if they sweat easily or excessively. If they do, then one could ask further questions. At all times when we treat problems with sweating, we should also treat problem of heat or cold in the body. First, in the case of excessive sweating anywhere, lung 7, kidney 7 should be used. Lung 7 closes the skin pores, while Li4 opens them. Kidney 7 tonifies water. which means it stops the unnecessary loss of water from the body. There are two popular symptomatic points against sweating due to any energy imbalance. So for excessive heat and excessive watery sweat, so that means the heart is involved or the heart yin is so increased or is increased as a reaction to excess yang. If there is heat without sweat, so that's in the kidney or lung. Night sweat, this is very common in the kidney or lung. Concentrated smelly sweat, especially in the axilla. There is heart dryness and heat in the body area. If you have sweaty feet, that's kidney. Oily, fatty sweat, spleen, and in the lung. Cold sweating, chronic. Yang deficiency in relevant part of the body, and qi deficiency in the lung. So obviously, it's the lung that is involved here. Treatment. For heart yin and yang excess, heart yin increasing because of heart yang excess. SI8 sedation, so this is indirect sedation of heart yang. The heart yin will come down automatically when the yang is sedated. Sedate, triple warmer 10. This is indirect sedation of the pericardium yang. Spleen 6 descending technique, Ren 14, the front view of the heart. Lung 7, kidney 7, these are the points to close skin pores and tonify water. If there is hyperfunction of the thyroid gland, then unblocking the Ren meridian with points Ren 3, 22, and 24 would be beneficial. Heart yin deficiency, we use Ren 13, the front move, and Heart 8, the house element point. Avoid heat and coffee, and sleep much more. Heart 5, the luo connecting, would be very useful because it prevents the yang from rising intermittently. Kidney yin deficiency. Gallbladder 25, front move of the kidney. Kidney 10, drink more water, avoid heat. So if you have dampness in the spleen and lung, bladder 13, bladder 20, which are the Bakshu points, stomach 40, Li6, the luo points of the spleen and lung, respectively. Avoid milk products, refined sweets, and carbohydrates. Improve the skin or lung function. Use bladder 13, the Bakshu point, and Li11, indirect tonification. Thank you very much for your attention. Let us now call once again Sir Dino Pinheiro of Legazpi for his discussion of the metal element. Good afternoon ulit, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with the metal element, the concept. Now we have the table, the climatic pathogenic factor, and sa symptoms, there is severe fever, mild chills, headache, hot head, excessive thirst. Sa cold, there is severe chills, mild fever, headache, no thirst. Pag damp naman, there is puffiness of skin, may edema in the periphery, heavy limbs, heavy-headed headache, mucus in nose or throat. Sa wind naman, there is aversion to wind on skin, sneezing, itchy eyes or throat, headache with wandering muscle pains. Dry naman, dry tight skin, dry nose and throat, itching or sneezing, dry cough. Next, sa tongue coating, pag merong heat, there is yellow coating, tongue color will not change in an exterior problem. Pag merong cold, white coating, no change in tongue color. Pag damp, there is slimy coating. Pag wind, thin coating, yellow or white according to heat or cold wind. Sa dry, there is dry coating, cracks, or peeled coating. Sa pulse quality, pag merong heat, superficial, rapid pulse. Pag cold naman, there is superficial, slow pulse. Pag meron damp, superficial, slippery pulse as if touching a drop of mercury, a slippery pearl. Pag wind, there is superficial, wiry pulse like a tight guitar string. Pag dry, there is a superficial thin pulse just under the skin, more rapid. Sa treatment, if there's presence of heat, we sedate heart 6, small intestine 8, LI4, LI11, hot spicy soup, and warm bed to encourage sweating. Pag there is cold, sedate kidney 5, LI4, LI11, hot spicy soup like above. Sa damp, we sedate spleen 8, LI4, LI11, hot spicy soup like above. Pag there's wind, sedate liver 6, GP38, LI4, LI11, hot spicy soup like above, wind elimination. Pag dry, tonify lung 1, kidney 10, LI11, drink water and eat salty food, REN 17. In all cases, in table 12.1, the C-clef point is used to sedate the climatic pathogenic factor, except in the case of dryness. LI11, LI4, and hot spicy soups are used to improve the open elimination function. As long as the climatic pathogenic factor is in the exterior, there is a superficial pulse indicating that the pathogenic factor has not yet moved deeper. When it does move deeper, the depth of the pulse will also change to a deeper level. So, mas lumalalim. The pulse quality, rapid, slow, slippery, wiry, and thin, indicates heat, cold, damp, wind, or dry quality of the pathogenic factor. The tongue color and form indicate the interior situation of blood, fluid, and energy. But the coating indicates the various climatic pathogenic factors that attack the body. This is why, sabi ng author, I have not included tongue color dun sa table 12.1. As you see here, the skin is the outer armor that protects the body, helping us to adapt quickly to climatic changes around us. The eliminating exogenous pathogenic factor when they attack and try to enter the body, if the body is a fortress, then the skin forms the outer walls with soldiers guarding against the possible entry of the enemy. Elimination is not only about skin. Stools are another important elimination function. Without this function, we would not be able to get rid of waste and toxins from the body. The large intestine is an eliminator not only for the metal element, but for the entire body. For problems with elimination in any organ of the body, the large intestine should be tonified to improve this function. Sabi niya, I illustrate this point in the case example below. Thank you for listening.
Thank you very much, Sir Dino. Let's now welcome Ma'am Lynn Galarita for the next presentation. She will continue her discussion of the 8 principal syndromes. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. So today we'll continue our discussion on syndrome differentiation. Last time we discussed about exterior syndrome. So for today, we'll discuss interior syndrome. So what is interior syndrome? This indicates that the disease is in the interior parts of the body, such as the Zangfu organs, qi and blood, and the marrow. Interior syndrome is commonly seen in the intermediate and late stages of diseases caused by exogenous pathogenic factors or diseases which result from internal injury. again, comparing to an enemy invasion in a country. In interior syndrome, it's like if our enemy are unable to if our army are unable to resist the enemy's invasion, then the enemy will invade into our city, even the capital, and the condition is more serious at this time. So, in interior syndrome, the disease is in the interior parts of the body. Among the symptoms of interior syndrome are the following. This is characterized by a wide variety of symptoms and with different diseases location. Like there is high fever, dysphoria, coma, thirst, abdominal pain, constipation or diarrhea, vomiting, short micturition with dark color urine, yellow or white or thick and greasy tongue coating, and a deep pulse. So for the treatment principle, different treatments according to various causative factors, such as warm the interior. If there is heat, we clear away the heat. If there is constipation, we relieve constipation. If there's indigestion, we promote digestion. And if there is yang deficiency, we reinforce the yang. So how do we identify exterior versus interior syndrome? So in exterior syndrome, it's a new disease. Its duration is just short. Kumbaga, ito yung mga sinasabing acute. Interior syndrome, on the other hand, are all diseases long duration. In exterior syndrome, we can see fever, aversion to cold, or to wind. Whereas in interior syndrome, the fever caused by exogenous pathogens, there's fever which is caused by exogenous pathogens, but without aversion to cold or to wind. There is fever due to exogenous damages. The tongue in exterior syndrome will present with the white thin tongue coating, which is relatively normal. While in interior syndrome, there is already a remarkable change in the tongue coating. Example, we can see a yellow tongue coating, a thick and slimy coat, or a dark red tongue, or a pale tongue, etc. The pulse in exterior syndrome is usually superficial, while in interior syndrome, deep pulse. Okay, there is a between interior and exterior, we also have this condition where we can, which is neither interior nor exterior. So this is half exterior or half interior syndrome. This happens during the penetration of exogenous pathogenic factor from interior or from exterior to interior, or in the exteriorization of interior syndrome, the pathogenic factors just come to its halfway. So the disease location is neither exterior nor interior, but just in between. As for the symptoms, we can see alternating fever and chills, nausea, vomiting, distressing fullness in the chest and hypochondriac region, restlessness, a bitter taste in the mouth, dry throat with no desire for food and drink. There is vertigo and a wiry pulse. In summary, the main points for distinguishing exterior and interior syndrome are the following. One, we look into the changes of cold and heat. For exterior syndrome, there's fever accompanied by aversion to cold. For interior syndrome, there's fever without aversion to cold or aversion to cold without fever. The tongue in exterior syndrome is comparatively mild and the tongue coating remains unchanged. While in interior syndrome, it's relatively severe with changes in the tongue coating by the dysfunction of some Zhangfu organs. The pulse will be superficial in exterior syndrome and deep in interior syndrome. So that's all for now. Join us again next time as we continue with the syndrome differentiation. Thank you.
Thank you very much, Ma'am Lynn. Let's call once again Mom Needs You, certified acupuncturist of Silang Cavite, for the 5-element points. Good afternoon ulit, Ma'am Needs.
Good afternoon, Doc Hector and everyone. So we have a new topic, the 5-element points. Okay. So there are many ways of using the 5-element points. Two ways are to use the nourishing relationship and the controlling relationship as we had just did. But there are many other possibilities. As acupuncture developed and independently in many parts of China, many interpretations of TCM laws are also developed. Okay? Using the 5-element points for influencing energy according to elements. Ito, binigay dito. For instance, some schools use the 5-element points according to the energy of the element. Tonifying the 5 point of a meridian to increase heat and activity, and sedating it to disperse heat and cure inflammation. So, yun po. Example, liver 2 tonifies or sedates the yang. Okay? Tonifying the earth point to improve nutrition and sedating it to eliminate dampness. Example, lung 9. Yan po yung point na gagamitin. It can be used to tonify the lung blood or sedate lung dampness. Tonifying metal point in order to improve dispersion and elimination, and sedating it to control dysfunctions. For example, heart 4, it could be tonified or sedated in order to increase or decrease sweating. Okay? Tonifying water point to improve the moisture in an organ, to cool and soften it, or sedating it to eliminate the thin fluids. Example, lung 5, it can be tonified or sedated so it can either hold onto water or descend it to the kidneys. Okay? Tonifying the wood point to improve tension and movement in an organ, and sedating it to reduce tension and to calm an organ. So same points are used for tonification and sedation, but with different needle techniques. Okay, so you have to study the techniques. Next is using the 5-element points according to seasons. As the 5 elements are associated to the 5 seasons, there is also a possibility to use them not according to which energy is affected, but depending on the season in which the symptoms manifest. Okay. For example, if respiratory diseases manifest in spring, then the wood point of lung 11 should be used. If symptoms show up in winter, then the water point of the lung 5 must be used, and so on. Okay? This method is not so useful in illnesses that appear all year round. So you have to understand and research. Okay? Thank you for your attention, everyone.
Thank you very much, Mom Needs You. Let's call once again Mom Lynn for meridian theory.
Good afternoon ulit. For today, we have a new topic on the meridian theory. We'll discuss about the liver meridian of the foot extreme yin. Okay. The liver meridian of the foot extreme yin begins on the lateral side of the big toe running upwards along the dorsum of the foot and ankle, the medial side of the leg, and then curving around the external genital area and going up to the abdomen and ending between the ribs at the mammary line. For its internal branches, in the abdomen, the meridian enters the liver, gallbladder, and ascends further to enter the eye. Still ascending further, it goes to the forehead and meets with the due meridian at point due 1. The eye branch flows down towards the lips and curls around the lips, and the branch arising from the liver connects with the lung. So let's start exploring the first 5 acupuncture points on the liver meridian. We'll start with liver 1. Liver 1 is on the lateral aspect of the big toe. Point 1 tune proximal and lateral to the corner of the nail. This is the wood point and the house element point of the meridian, and it is used in tonifying liver yin, a great point in the treatment of fat craving. Okay. Next point is liver 2. This is between the first and second toes, proximal to the margin of the interdigital web. This is the sedation point, the 5 point of the liver. This sedates much more the yin aspect and some yang as well. It is also a wind eliminating point, and as the liver generates internal wind for the entire body, it is a good point to calm the liver and eliminate the irritating wind. Next up is liver 3. It is in the dorsum of the foot between the first and second metatarsal bones in the depression proximal to the metatarsal phalangeal joints and the proximal angle between the two bones. Again, one of the most important points in acupuncture. This is a good point against nervousness, stress, and tension, against both high and low blood pressure. This is the Yuan source point of the meridian and can be used in tonification or sedation. In fact, this is one point which can be used in both high and low blood pressure. The next point is liver 4. It is one tune anterior to the prominence of the medial malleolus, medial to the tendon of the tibialis anterior muscle. This is the metal point and the grandmother point of the liver. This is used to tonify the yang of this yin organ. It is a good point to improve the ability to deal with one's anger, to enable one to be assertive and raise the voice when necessary. It tenses the muscle tone, hence it's good for raising the blood pressure. And this point works much better when large intestine function is good. Next point is liver 5. It's located on the medial aspect of the lower leg, 5 tune proximal to the highest prominence of the medial malleolus at the posterior border of the tibia. This is the luo connecting point of the liver, which tonifies liver yin and reduces its yang at the same time. It is an excellent point for the following combination of symptoms: dry eyes with recurrent redness and conjunctivitis, spontaneous and excessive bleeding from any part of the body, sudden and uncontrolled outburst of anger. These are examples of yin deficiency and yang hyperactivity in the liver, where liver 5 is suitable to use. This is all for now. Join us again next time as we continue our discussion on the liver meridian. Thank you for listening.
Thank you very much, Ma'am Lynn Galarita. We now come to the last topic for today, still on chronic fatigue syndrome, the Western concept. Shepard considers two types of onset for chronic fatigue syndrome: a frank acute onset following a clear infection, and an insidious onset without an apparent infection. The first type is more common. A previously healthy individual contracts an acute infection, and after an apparent recovery, the symptoms persist and the patient never recovers. When the symptoms appear after an acute infection, typically this can be influenza or influenza-like infection, a specific infection such as varicella or chickenpox, acute mononucleosis, or gastroenteritis. The symptoms at this acute stage would include fever, shivering, aches, swollen glands, and fatigue. Other symptoms may be present depending on type of infection, like vomiting, nausea, diarrhea, earache, dizziness, sore throat, or cough. After an apparent recovery from the above symptoms, the person starts to feel unwell again, and various symptoms persist ever after. So here we could see a very simplified schema of what happens when one is experiencing chronic fatigue syndrome, or the pathology of chronic fatigue syndrome in viral infections. So eventually it affects the brain and the muscles. Okay, so let's start with the virus. And we have to consider cofactors like age, stress, are more common in females, and it's genetic. And then the importance of an immune response. So if you have an inadequate or a weak immune response, then definitely the virus will persist and the virus can be reactivated. And when that happens, you will now have affected the brain, resulting in poor memory and concentration, and the muscles, resulting in muscle ache, fatigue, and heaviness. From the Chinese perspective, this is clearly due to a residual pathogenic factor in the form of dampness. The recurrent history is that of a patient contracting an acute infection at the time of overwork and stress, and of a patient who continues to overwork during or soon after the infection. In the second type of CFS, the onset is gradual and insidious, and it does not follow an obvious infection. The symptoms seem to develop over a longer period of time with recurrent mild infections, sore throat, swollen glands. Shepard says, it may be that infection with the right virus did take place, and that, although it caused no obvious bout of illness at the time, it went on to persist in the body, eventually causing the characteristic features to appear. This is an uncannily accurate description of the Chinese pathology of latent heat, an infection that affects the body without causing, that's why it's called latent, without causing any symptoms or without causing immediate symptoms, and that manifests later with an insidious onset. Some doctors restrict the definition of chronic fatigue syndrome to the second type, that is, one that develops with a gradual and insidious onset and is accompanied by evidence of persistent infection by enteroviruses. They take a view that is exactly the opposite of the one reported above, that is, that true CFS is the one developing in the aftermath of an acute viral infection. Smith considers acute onset post-viral fatigue syndrome different from CFS. He thinks true CFS is insidious and has a slow gradual onset, while AOP VFS has a frank onset after an acute viral illness. As AOP-VFS is caused by residual pathogenic factor, it would mean that Dr. Smith considers true CFS only that caused by latent heat. So let us summarize what we have taken up. Chronic fatigue syndrome in Western medicine. ME, or myalgic encephalomyelitis, or chronic fatigue syndrome, is a relatively new disease. It is a disabling and complex illness. Some of the areas that are being studied as possible causes are infections, immune system changes, stress affecting body chemistry, changes in energy production, and possible genetic link. Researchers have not yet found what causes ME or CFS, and there are no specific laboratory tests to diagnose directly. Therefore, doctors need to consider the diagnosis based on in-depth evaluation of a person's symptoms and medical history. Thank you very much for your attention, and thank you very much for joining us today. And we hope to see you again in our next presentation. Thank you.